the administration risk looking out of touch with where the country is heading in terms of lifting these mask mandates if the CDC doesn't revise its guidelines?
Well, again, we understand where the emotions of the country are, right? People are tired of masks. I would say not even if you look at the polling, though. There is also a huge chunk of people who still want masks, right? So it's not even that specific. It's just that, as you noted, there are some states that are moving towards rolling back or giving more choice to local communities about how they will implement these requirements. But again, from the federal government, what our responsibility to do is to abide by what the president committed to on the campaign, which is to listen to scientists, listen to data. That doesn't move at the speed of politics, it moves at the speed of data. And they, Dr. Walensky, committed to, conveyed, or I should say confirmed, that they were evaluating this at the CDC.
Hello everyone and welcome to this episode of Ignition Time. Now, let's be clear, we are all fed up of wearing masks. In fact, I know some of us probably don't even wear masks anymore. And I wouldn't be surprised if some of our viewers and subscribers have never worn masks. My goal is to give you important information pertaining to the country, the economy, as well as our money. And here are all the states that are lifting mask mandates soon. In fact, a growing number of states from New York to California have announced this week that they have plans to roll back indoor mask mandates in the coming days. And some others, like Connecticut and New Jersey, are actually eliminating mask mandates in schools. So let's take a look at the states that are actually lifting mask mandates at this moment in time. New York is lifting the indoors mask mandate effective the 9th of February. So basically, by the time you watch this video, the indoor mask mandate in New York would have already been lifted. Rhode Island is lifting indoor mask mandates on the 11th of February. California is lifting indoor mask mandates right after Valentine's Day on the 15th of February. Delaware, indoor mask mandates have already been lifted effective February 1st, and in schools, indoor mask mandates are going to be lifted March 31st. Massachusetts is going to lift mask mandates in schools effective the 28th of February. New Jersey is going to lift mask mandates in schools effective the 7th of March. Oregon is going to lift mask mandates in schools effective the 31st of March. Connecticut will lift mask mandates in schools effective the 28th of February. And Illinois will lift mask mandates indoors effective the 28th of February, the same day as Connecticut lifts mask mandates in schools. Now, the White House has yet to provide guidance on mask wearing for the general public. Remember, there's a difference between state-specific mandates and federal mandates. States are always free to essentially implement their own mandates, which they have done throughout the pandemic. But what the White House is doing is urging students, teachers, and parents to follow CDC guidelines, Center for Disease Control guidelines, when making decisions about mask wearing in schools, regardless of what the state says. Now, let's take a look at what Dr. Rochelle Walensky, the head of the U.S. Center for Disease Control and Prevention, she said now is not the time to change recommendations or loosen restrictions aimed at preventing COVID. This is what she said. Right now, we still have about 290,000 cases every single day, and our hospitalization rates now are higher than they were even at the peak of our Delta surge. So, in this moment, while we are looking ahead and planning ahead, and we'll continue to evaluate and follow the science, our recommendations are consistent with encouraging students to wear well-fitting masks. So let me know where you stand with this as different states are loosening their mask restrictions. Are you in favor of this? Are you not in favor of this? Guys, let's not make this a political issue. Let's just make this an issue that revolves around science and that revolves around our personal beliefs, because at the end of the day, that is what this should be about. So let me know what you think. But before we do that, let's take a look at this really interesting interview on CNN featuring Dr. Edith Bracco Sanchez, who's a pediatrician at Columbia University Irving Medical Center, and she expressed her opinion about different states lifting mask mandates, and she essentially said she couldn't understand it because she said it was not based on science. Now, it makes sense as a medical professional. It makes sense for Dr. Sanchez as a medical professional to say, hey, let's continue to keep masks on because at the end of the day, prevention is better than cure. But let's listen to what the doctor says, and And then I have an important question for our viewers and subscribers about this subject. So make sure you watch the video all the way through to the end. But first, let's roll the tape and hear from Dr. Sanchez. Let's watch and let's see her opinion and her reaction to states lifting mask mandates nationwide, both indoors as well as in schools. This is happening in a gradual manner because, again, like I mentioned at the start of this video, different states are making different decisions. Let's see what the doctor had to say. Let's roll the tape and watch.
This is Dr. Edith Bracho Sanchez. She's a pediatrician at Columbia University Irving Medical Center here in New York. It's great to see you again, doctor. What do you think of these mask rule rollbacks we're seeing in so many states now?
Kate, I am having a hard time understanding what data this is based on. As you just reported, yes, Omicron cases are down. That is reassuring. But it's almost like we've gone from an extremely high level of cases to just a high level of cases. We still have over 2,500 Americans dying every day. The rates of vaccination in children are dismal. I mean, they're disappointing. We still don't have a vaccine for young children. So it's really hard for me to understand this as anything other than a political move to get people's votes rather than to prioritize their health, Kate.
It's interesting because it's, partly driven, it all, as we've been seeing with public health efforts, it's partly driven by science, and we'd be lying if we said it isn't partly driven by public sentiment and politics. And that's probably the combination of what is happening, yeah?
That's exactly right. I think what's key here is to see who is making these decisions. I mean, these are governors, right? This is not the CDC. The CDC has said, wait a minute. And Dr. Fauci's saying there's a new phase coming. We have hope in the horizon. I understand the frustration, but it just feels like we're getting a little bit ahead of ourselves, Kate.
Let's focus in specifically on schools. As I mentioned, you're a pediatrician, and schools are a category to themselves. Some states, as they're rolling back indoor mask mandates, they're not rolling back school mask mandates yet, and other states taking a different tact. I want to play for you how the CDC director is talking about this.
We've always said that the state and local jurisdictions are the ones responsible for those kinds of policies, for masking policies. Right now, our CDC guidance has not changed. We have and continue to recommend masking in areas of high and substantial transmission. That is essentially everywhere in the country in public indoor settings.
Do you think the consideration for, is what we're talking about with mask rules, should be different for schools kind of as we enter the new normal?
Gosh, Kate, I wish we were at a place where I could say in good conscience that schools should roll back their mask mandates. I just don't believe we're there yet. As we were starting to mention, the vaccination rates in children are dismal. We don't have a vaccine for kids under 5 yet. And unfortunately, this can be a serious illness for kids. I know there are a lot of people who want to sort of dismiss this, who want to tell us, this is not a big deal. Let kids get infected. It's going to happen sooner or later. I've been told that with my own child who's going to be 6 months in March. Edith, what's the big deal? He's going to get it sooner or later. This is a big deal, Kate, and we know that masks work. I sound like a broken record. I know people are tired, but this is one tool we have until we're in a better place to protect children.
So that's where we are, everyone. And now I have an important question for our viewers and our subscribers. Do you agree with different states lifting mask mandates? Do you think this is the right time to lift mandates? Or are you concerned, are you fearful even that lifting mask mandates at this time could lead to a resurgence in cases? Now, there are two schools of thought here. One is, hey, let's just keep the masks on a couple months longer maybe because we don't want a resurgence in cases. Or the other point of view is, hey, how long are we going to remain masked? How long are we going to continue to do this? At some point, we have to get back to normal life. So this is a complex subject, folks. This is not a black and white matter. I want our viewers and subscribers to know that this is not a black and white matter. In fact, there are many, many shades of gray in this situation, and I want to know where you stand. Please let me know whether you agree or disagree with states removing their mask mandates and saying, hey, masks are no longer required indoors or in schools. Do you agree or disagree with states doing this? Also, let me know what your state is doing, which state you're from, in the comment section below. Thank you so much for watching. My name is Dr. Nitin Chhoda with Ignition Time. Please click the like button. Please click subscribe. Please enable notifications. I work hard on this channel every single day to bring you the latest news, and I'll continue to do that. This channel, the Ignition Time channel, is about the country, the economy, as well as our money. I appreciate you. Please again click the like button, click subscribe. Please enable notifications. I'm looking forward to seeing you in the next episode of Ignition Time. Take care. Bye.